Are you facing challenges in your health? Then Dr. Suleiman Clinic and Labs is here to provide you with the lasting solutions to your health problems. Dr. Suleiman Clinic and Labs is specialized and offers consulting in psychiatry, internal medicine, cardiology, urology, dermatology, gynecology, infectious diseases, and infertility. At Dr. Suleiman Clinic and Labs, we offer 3D/4D scan at just 5,000 francs, emergency ambulance, free ultrasound scan, and free medical consultations. Our staff is composed of well-trained doctors with good laboratory and best equipment. We are located in 2 cities, Boya at Mile 18 Bolifamba, and in Douala, we are located at Entrée Pilote. You can reach us through the telephone number 694-940-172. Your health is at the right place with Dr. Suleiman.
Yes, back again. How are you? Again, I'd like to announce the surgical team, a specialized surgical team arriving to Cameroon next week. We will be doing all kind of surgeries for free, no charge, all charity cases. If you have any problem that requires surgery, whether thyroid, general surgery, gynecological surgery, cancer surgery, any surgery that you want to do, we have about 9 specialists, different kind of branches of surgery will be arriving to Cameroon next week. Surgeries will be taking place in Marwa. If you need a surgery, you let me know. And if you know somebody who needs a surgery, you let me know. Surgeries are done free of charge by a highly specialized team. All right, we're back again. We're going to discuss now this time something that concerns the skin. We have a picture that I like to share with you, and then we discuss about the skin. We play that picture, please. Yes. Looking at this picture here, we see, if you look carefully, it's actually a white skin here. Okay, it's actually a white skin. If you look deeper into that picture, you will see that, it is kind of purple. It's kind of purple, right? Yes, it's kind of purple. Why is it purple? Because this lesion is rich for capillaries and blood supply. There's a lot of blood there. And if you pay close attention, you will find that lesion is raised above the skin a couple of millimeters. So it is not at the same level of the skin, meaning if you touch it, it's like it bumps up a little bit. You have to bump up a little bit. So that is what this lesion is all about. And if you look closer also to the lesion, you find that it is not even borders. It's not even borders, meaning one side is higher than the other. If you look at the circumference, of the lesion, you don't find it even. So now, let me tell you what that is. This is what we call, we see this, at least a couple of times in the clinic, 3 times in a week, okay? And this is a lesion that is associated with HIV patients. This lesion called Kaposi sarcoma. It's a cancer of the skin, exactly like you heard, cancer of the skin. And it usually appears like this when the CD4 count goes low. What is CD4? CD4 is a T lymphocyte. What is a T lymphocyte? It's your line of defense against viruses. This cells secrete something called interferon, which is the weapon against different viruses and parasites. And even tumor cells, TCD4 is very important for us to fight. And that is what HIV attacks. It attacks your line of defense against viruses. So basically, it makes its way by killing the first line of defense. I mean, the most effective line of defense, which is CD4, because we also have CD8, but CD8 is not affected as much as CD4. CD4 is number 1 victim for HIV. So when the CD4 goes low, that means what? That means the viral load has gone up. When the viral load goes up or the CD4 count goes low, basically both terms mean the same thing. Your immune system is a little bit out of whack, is low. And this is when this Kaposi sarcoma can show. We can have patients with HIV all their life and we never see the lesion. We can have a patient with HIV a couple of years and we see the lesion. It all depends on the immune system of that particular patient and how high or low the CD4 count is. Can this lesion be treated? Yes, absolutely it can be treated, and the treatment is quite easy. The most essential treatment is to work on raising the CD4. The second thing, we can inject the lesion slowly with some medication and it will make the lesion disappear. The fourth, we can have some ointment, special ointment that we apply to the lesion and the lesion will go. The lesion can be in a very embarrassing places like the face, the hands, where it can be seen, the lower legs, which is very nasty, but it could go away. So this is a condition. What I want to teach you here is something very important. We have discussed, I don't know whether in this TV station or another DC station, we have discussed how you differentiate between a skin cancer lesion and a lesion that is benign. Benign means is not cancerous. If you look at the lesion, and I have a slide that says even borders. If you can look for the word even borders among those slides, the slide is there. If I look at this lesion and I find even borders, meaning no ups, no downs, is all even, that's a benign skin lesion. That's a benign skin lesion. But on the other hand, if I look at a lesion and I see it like just the one I played on the screen, now you see the borders are uneven, this is something that is cancerous, like this Kaposi sarcoma. That is because of HIV infection. Yes, we can treat the Kaposi sarcoma. And the earliest you recognize the Kaposi sarcoma, okay, is purple and is raised above the skin and uneven borders. Those are the three things that you should look for. If you have this lesion, you let us know. We will take care of it. But the most important thing is you cannot be taking the treatment for this lesion and you're not taking the ART, the treatment for HIV. You cannot do that. Because once you raise the CD4, it's very easy for this lesion to go away. So you must raise the CD4. Now, how can we decrease the risk for having HIV? HIV is transmitted by mainly sex. Now today we have two groups of two different sex groups, or let's say sex preference. We have the homosexuals, those men who prefer to have sex with men. And we have the heterosexuals, men who prefer to have sex with women. Looking at the two groups here, the homosexuals and the heterosexuals, which one you think will have more HIV? Which one would you think will have more risk to have HIV? The heterosexuals or the homosexuals? Well, data have showed us, and all medical evidence has showed us, those homosexuals are at very much higher risk to catch HIV than the heterosexuals. Why? Because homosexuals prefer anal sex, rectal sex. And if we look at the anatomy and the physiology of the rectum, we find it very rich of capillaries and very fine blood supply. That with the act of intercourse, they get ruptured. And you have now direct blood contamination, especially if you have a laceration on your penis. So now we have blood-to-blood contact, and that is HIV, if the patient is infected, and most of them are, because of that fact. Now, with heterosexual, vagina is not the anus. So it is totally different. Anatomy, different physiology. When God made us, He didn't make us to have sexual intercourse in the anus. Otherwise, why would He make the vagina? So what is the vaginal function here? It's for what? It's to defecate from. We have one thing for defecation, where the stools come out, and we have thing to enjoy sexual intercourse, the vagina. So those with before, and I said it once before, Those who are homosexually oriented, men prefer to have sex with men. Those years ago, in the DSM-3 and 4, they were diagnosed as mental disease. Now that they have so much influence with different lobbies, now it's sexual preference. I prefer to have, I was born a man, but now, for some reason, I feel like I'm a woman. What is that? That's mental disease. And believe it or not, there are treatment for them to become straight. It's a disease that requires intervention and medication and therapy, So it's a disease. It was long time a disease, a mental case, a mental disease that has to be treated. What has changed it? Influence, money, power, God knows what. It's not my business. But it's a disease. And I consider it as of today, till the day I die, it's a disease that has to be fixed. So homosexuality is a disease. So now, and that is the consequences. HIV. Now we have the bisexuals that work in the daytime, homosexual, and at night who works heterosexual. And those are the ones that transmit the virus from here to there. So they're spreading the virus more. What is the advice? Be careful who you have sex with. Make sure you test HIV. Believe me, I have patients who have tested negative 3 months ago, positive today. It takes, when we test for HIV, we test against the antibody. Antibody meaning something that your body has produced to protect you against the virus or pieces of the virus. That is what we call antibody. We cannot, till today, test against the virus or pieces of the virus directly. So we test against the virus indirectly by testing for the presence of antibody that your body has formed against pieces of that virus. That's what we do today. That process to make antibody against the virus and then test positive, it requires 3 to 4 months. So if, God forbid, you catch the virus today, you can only test positive 3 to 4 months later. So what is the advice? Be careful who you have sex with. Get yourself checked routinely. Believe me, I have seen in my practice a wife and a husband. The wife has it and she wouldn't tell the husband that she has it. A husband have it and he wouldn't tell the wife that he has it. Especially the woman. Why? Why don't you say, I'm afraid he will leave me. But is this enough reason to kill somebody? I mean, not kill, but at least. What if he finds out? He gets checked out and he finds that he has HIV. Then what are you going to do? It is sad. So the advice is, be careful out there, okay? If you decide to have sex, get your partner checked. Get yourself checked. Use condoms, even though, and this may be the first time you hear that, condoms offer you 84% protection. 84%. You remain with 16% unprotected. You're not protected 16% of the times. You're protected 84% of the time. 16% of the time, you're not protected. Condom cannot offer you that protection 100%. There is no 100% condoms. Let's move to another lesion. Now, before I move to another lesion, I just play any of those lesions with the face, ulcerative lesion there in the face. The most important factor for this one that I just showed you, the Kaposi sarcoma with HIV-related lesion, skin lesion, there is another lesion. Most of the other lesions that show in the face is actually because of sun exposure. Not this one. This one is impetigo. No, most of the other lesions that shows in the face is because of sun exposure. So if you are a farmer, if you sell in the market, if you have to be in the sun a long time, be careful to protect your face. Put a big hat over your head, put an umbrella, protect your face, protect your skin from exposure to sun. Because the sun is the number one number one cause for skin cancer of the face or the sun exposed areas. Okay, this is advice very easy. Like for example, this one here, that's a shiny waxy lesion on the nose, and that is basal cell carcinoma, I believe. You know, so this is, don't worry about the names, those are cancer. And if you look at the lesion is uneven border. The borders are not equal. It's not round like, no, it's uneven. One area is up, another area is down, then it goes up again, then down again. So uneven borders, that's the distinction and the hallmark of a skin cancer. So that's a skin cancer. You know, a benign lesion will not be looking like this. So all kind of lesions on the face, if you see one, that is because sun exposure. The advice is avoid the sun. There are some products that call sunscreen. They have sunscreen factor. Look for the things that say, and also have the hours. You know, this is cellulitis. This is also another condition, but it's not cancer. This is another condition, but it's not cancer. Well, let me see. I'll send you that. Let me see. So let's now, you know, something like this. Also something like this. Let me see here. Let me see. I don't think I brought it with me. Anyhow, so what I'm trying to say is the following: avoid the sun at all times. And if you have to go to the sun, protect your face, protect the area that is exposed to the sun by a big hat or by an umbrella, or by applying a cream that says sun factor. Sun factor protection. It says the hours. If it says 8 hours, you know that you have to repeat to apply the cream again after 3 hours or 4 hours, because they're not always saying the full truth. If they say 8 hours, you assume it's about 6 hours. If they say 5 hours on the sunscreen, then you assume it's about 3 hours or so. So protect your skin from sun exposure. You avoid a lot of skin cancer. But in Africa, we are blessed because, you know, the black skin actually has rich melanocytes. Melanocytes is the cell that produces that black skin. So the more melanocytes you have, okay, that has more active melanocytes, more active meaning they produce in melanin, which is the dark dye that causes dark skin. This melanin is, if the cell is active, you become more dark. If the cell is less active, you become less dark, and so on. So when the skin is rich with melanocytes that are active, producing dark melanin, you're very much protected, less likely to get the skin cancer, but you still can have it though. So the best thing is to avoid sun exposure because we have a lot of sun. Now, what else should I advise you with? I get patients that have hyperpigmentation in this area here. What is this? This area that is coming out, those are the cheeks, right there, always come very hyperpigmented, very dark. Why? Because this is the area that is most likely exposed to the sun more. So it becomes hyperpigmented. So before the lady leaves the house, she bought her, you know, oil. She bought her oil, she bought her body cream, she bought her body lotion, and especially in the face, she bought a lot of lotion, and then she goes out. And where she buys her lotion or the face cream that she bought on her face from those side road streets, and that doesn't even have a label on it. And after reading few patients who have the creams that they brought, we find all of them have ascorbic acid. Ascorbic acid is vitamin C. Never put vitamin C in your skin and go out in the sun. You know, when vitamin C unite or combine or react with other chemicals in the cream, they call carboxyl or ascorbyl complex. They call it ascorbyl complex. This ascorbyl complex, when it reacts with the sun, when it sees the sun, it causes activation of the melanocytes to produce more melanin. So this is ascorbyl complex. Ascorbic coming from ascorbic acid. Ascorbic acid is the vitamin C that this cream has in it, and you don't even know because most of them don't even have a label to tell you what's inside. So any cream that you put in your face and you go out in the sun and this area becomes dark, you know you have a problem that this cream has ascorbic acid or vitamin C. So what is the solution? Do not put nothing in your face when you go out. When you go out to the sun, do not put cream in your face. The only thing you have to do is something that protects you from the sun. There are creams to protect you from the sun. And they will say on the side, S factor, or the sun exposure factor. You look for something that if it says 4 hours, then you renew the cream, you reapply the cream every 2 hours. That is the advice for those who are decide to put cream and go out in the sun. In the next 5 minutes or so, we will be talking about this slide here. We're talking about now superficial skin infection. When we say superficial, meaning, you know, the skin has layers. One is the epidermis, which is the outermost, and then followed by the dermis and so on and so forth. Let's play this image and then we'll talk about the skin infections very quick. Now, yes, this is impetigo. This is impetigo. Impetigo meaning the only layer that is affected is the epidermis. There's nothing scary here. You just apply some topical cream and it will be gone. So what is the causative? The causative agent is always something called Staph aureus and Streptococcus group A. Now, in this case, it's just maybe a little bit of a Staph aureus is topical skin, topical ointment we apply to the skin and it's gone. So this is impetigo. Let's move to the next slide, please. Okay, let me see. I cannot see from here. Let me see. I cannot see very clearly from here. Anyway, okay, I see. Okay, this is actually skin tinea. Skin tinea is, you know, this is very common, by the way, very common. This is very common. This is what it looks like. It looks like, you know, you see uneven borders, different color from the skin. Sometimes it's darker, sometimes it's lighter. And the hallmark is when it starts like very small spots and it itches. It itches. This is, you find it mostly in folds, skin folds, like between the legs, under the armpit, you know, and it spread fast. It spread fast. This is tinea. A lot of people have it here because maybe the weather, maybe, you know, too much sweat and all that stuff, and it spread very fast. And it easily move from one place of the body to a different place of the body because you move it yourself with your direct inoculation. When you scratch it and then you scratch another part of your body, it moves right there. This is what we call tinea. The advice here, if you're taking something, I don't like to mention drugs names, but I will have to mention this drug name to warn you again. It's something called Griseoflovin. Do not take. If somebody tell you to take Griseoflovin for tinea, do not take, because that causes a lot of bad side effects. There is a very nice new medication. It's not really new, but it's very effective, very much, almost no side effects, because, you know, there are medication to treat those tinea and those stuffs that actually causes impotence, okay? So you have to be careful what you're taking, okay, and how long you take it for. Tinea is very much treated with ointment as long as no hair is involved and no nail is involved. No hair, no nail, just a small topical cream and it's gone. You don't have to exhaust yourself with Griseoflovin and all this stuff. That's a killer. You don't do that. No Griseoflovin for anything. Do not do it. Do not take it, even if it's given to you for free. Now, what I want to talk to you about, you know, is regarding those tinea. That's the point, because I see this, you know, patient comes, oh, I have tinea and I'm taking Griseoflovin for the last God knows how long. What? Why? If the tinea is only involving the skin, no hair is involved, because when it involves the hair, I'm talking about you see it in the head and it's eating much of the hair in the head. In this case, no, we can advance, you know, tablets plus the cream. But if it's only involving the cream, there is no need to take tablets of any kind. We just put a small cream on the lesion that's involving the skin and the problem will be solved. There is also something called ketoconazole. That's a drug that if you take see a lot of patients taking it, that causes impotence, my friend. And it also causes your breast to be like a woman's breast. If you're a man and you're taking this medication, don't. Because you have to be aware of the consequences. You will lose your sexual power and your breast will become like a woman's breast. Okay, so you don't want that. So before you decide to put something in your mouth, investigate what I'm putting in my mouth and see if it's safe or there is another alternative that is safer than this one. Because sometimes, because, you know, you don't want to pay a little bit extra, you lose something that is irreversible now. So I would like to again announce, and if you know somebody and you are watching me now, please spread the news that we have a surgical team, a specialized surgical team coming to Cameroon next Friday, and they will be doing all kinds of surgeries for free, and the surgeries will be taking place in Marwa. Thank you very much for watching, and I will see you next Thursday. You stay blessed and have a nice weekend.